Question 38. Which of the following is the most likely cause of his symptoms? Asthma, pneumoconiosis. Okay, it's a respiratory question. A 40-year-old man presents with several episodes of cough, fever, and chest tightness that occur shortly after finishing work at a lumber mill. Okay, so we got one of these weird exposures again. Nobody ever knows what that means, but we're going to make it make sense today. He first noticed these symptoms a few months ago, but they have progressively worsened over time. Okay, so this has been going on for a few months. So a few months means this is more of a chronic condition. His symptoms resolve overnight and on weekends. So that's really weird. They resolve overnight and on the weekend. So when he's not at work, he has no wheezing or nocturnal symptoms. Chest imaging shows diffuse ground glass opacities. So right away, wheezing, big buzzword for me. Wheezing means airway obstruction, bronchial tree narrowing. That is going to be an obstructive disease like asthma, chronic bronchitis. So asthma is going to be out because we don't have wheezing. What about recurrent infectious pneumonia? That really should be just a throw out answer. It goes away when he's not at work and it comes on when he's at work. That just doesn't make sense. What about ABPA, aspergillosis? So ABPA is due to an aspergillus infection. And this, I mean, it could be similar symptoms. It doesn't really make sense that it would resolve overnight and on weekends, though. I think that's a big one against it, a big strike against it right away. However, it can happen with strange exposures. The thing with this, though, is that it's these cavitary lesions that tend to develop and they can even move. So they are patchy. Sometimes they're cavitary. Here we've got ground glass opacities diffusely. So that just doesn't really sound like aspergillosis to me in combination with the overnight and weekend resolution of symptoms. So I'm going to cross that one off. Next up, we've got B and D, hypersensitivity pneumonitis and pneumoconiosis. So these two are very similar sounding. We're going to try and work these out and make them make sense. Let's think of hypersensitivity pneumonitis. Hypersensitivity sounds like hypersensitivity reaction, HSR. And I know since you're a good med student, you've memorized all your hypersensitivity reactions with Anki. If not, do that. It will help you. Hypersensitivity pneumonitis is believe it or not, a hypersensitivity reaction. Specifically, it's a type 3 and 4 hypersensitivity reaction. So type 3 hypersensitivity reactions involve immune complex formation. So antibodies bind antigen and then go off and deposit somewhere. Type 4 is your delayed T cell reaction. So if he's having a reaction to something at work, it would make sense that he notices his cough, fever, and chest tightness shortly after finishing work for the day, right? Because this is a delayed hypersensitivity reaction. Now, another really big component to separate pneumoconiosis from hypersensitivity pneumonitis are the types of antigens that you are exposed to here. So in pneumoconiosis, the offender is an inorganic antigen, something like silica, coal, asbestos. With hypersensitivity pneumonitis, it's an organic antigen, something like wood or fungus, something that was alive at some point makes your hypersensitivity pneumonitis. And that kind of makes sense if you think about it. If we're making antibodies against antigens, typically those antigens are from bacteria or viruses. So one way that you can help remember the difference, because this is something that I would definitely put in Anki, it's kind of just something you have to remember, but organic antigens, think hypersensitivity, hay, hypersensitive hay, like hay fever, right? That's a hypersensitivity reaction. So you get hypersensitivity with hay, which is an organic antigen, versus pneumoconiosis. These are just inorganic particles that get stuck in the lungs, get stuck in your lung macrophages, and just scar the lungs. Either way, both of these conditions will result in interstitial lung disease. The only difference is what type of antigen set it off. So here, this guy's working at a lumber mill. Therefore, probably safe to assume he's got a lot of exposure to wood, mold, and that could be triggering some hypersensitivity pneumonitis. So the correct answer is D.